It is the second leading cause of blindness worldwide. It's also known as the silent thief of sight. January is National Glaucoma Awareness Month, and joining me this morning is Dr. Kimberly Warren of Key Whitman Eye Center. You may know them best as experts in LASIK and treating cataracts, but they also have expertise in treating glaucoma. Good to have you with us.
Thank you. Good morning.
First question, who's most likely to develop glaucoma?
Well, patients who are most likely to develop glaucoma are individuals who are 40 years of age or older. They have a family history of glaucoma, or they have a disease like diabetes or high blood pressure. Also, African American patients and Hispanics are more at risk for developing glaucoma.
Okay, so what exactly is glaucoma and what causes it?
Well, glaucoma is a disease of the optic nerve, and which causes permanent vision loss. And it can be caused by elevated pressure in your eye or just poor circulation to the optic nerve. So that's why people that have high blood pressure or diabetes are more affected by glaucoma, because their optic nerve isn't getting enough oxygen and blood supply.
Okay, that makes sense. So how's it detected?
Well, that's the thing about glaucoma, is that it's a silent disease. So most patients don't know they have it. So it's real important that anybody, especially over the age of 40 or 50, comes in and has a comprehensive eye exam.
Right.
Because we can screen for things like glaucoma, cataracts, macular degeneration. But with macular degeneration and cataracts, you usually are symptomatic. You're having decreased vision. With glaucoma, you can have glaucoma and not know till very advanced stages that you had the disease. So that's why screening is so very important with glaucoma.
Okay, so let's say that you pick it up, that someone has glaucoma. What is the treatment? What do you do?
Well, that's the great thing, is that treatment is typically eye drops, which are very easy to do, or there's special lasers that we can use to treat glaucoma. And recently, there's been great innovation in patients who we're doing cataract surgery on. We've got a special techniques that we can use to decrease the use of drops. We can do the procedure at the same time that we're doing cataract surgery. So that's all very exciting. Those are micro-invasive techniques that we can use.
So you mentioned people who are most at risk for glaucoma. You also mentioned that it's silent and eye exams are so important. So if someone's sitting out there saying, I might be at risk for glaucoma, I have some of those risk factors, what advice would you give them about eye exams?
Well, absolutely, you need to be screened once a year. And we've got...
And starting at what age?
Well, 40, but for sure 50 to 55, especially if you have any risk factors, like someone in your family has glaucoma, an aunt, a grandmother, a brother, or if you are suffering from diabetes or high blood pressure. It is so important, because those diseases have so many other problems that can affect the eye that we really need to screen you. I mean, vision is so important, and there's so many things that are prevented now that you really, really want to have your eyes looked at. So if we see anything, we can prevent vision loss or permanent vision loss that glaucoma can cause.
You are a fellowship trained, which means extra trained ophthalmologist, seeing all your patients in Plano, but you have several Key Whitman Eye Center locations all throughout the area.
Absolutely. So we have the center at Plano. We also have our Dallas location. We have one location in North Dallas, also in Mesquite, and we have 2 locations in Arlington, one in South Arlington and one in North Arlington.
All right. Thanks for being here today.
Yes, thank you for having me.
January is National Glaucoma Month, so it's time to see about that. Call 972-769-2020 to schedule an appointment with Dr. Warren in Plano. You can also, of course, just go to keywhitman.com.